This afternoon, the CDC issued new recommendations that will have major implications for schools and businesses. According to the CDC, fully vaccinated Americans can now safely ditch their masks, even indoors and in large crowds. Now, this is a change from guidance the CDC issued just 16 days ago. Dr. Todd Ellerin is here to break it all down for us. Dr. Ellerin, there are some exceptions to this, like if you're traveling on buses or planes, if you're in a hospital setting. So where do fully vaccinated people still need to wear a mask?
So this is such good news, Diane. I think it's following the science. We know these vaccines are working to reduce infection, to reduce transmission, whether it's outdoors or indoors. So the exceptions are healthcare settings. They still, if you're working in a hospital like I am, or you're at a doctor's office or in nursing homes, you still have to wear your mask when you're indoors. Other settings, congregate settings like prisons, and then, of course, public transportation hubs, airports, buses, trains, etc., and homeless shelters. These are some of the areas where you still have to wear a mask, but for the most part, we get to take our masks off.
That's great news, no question about it, especially as the springtime is blooming all over the country. Dr. Allen, just over a couple of weeks ago, the CDC was advising vaccinated people could only take their masks off outdoors, inside, outside, on, off. It's confusing for people. Is there new data guiding this change, or is this a reaction to criticism that they were being too restrictive?
You know, Terry, I don't think it's a reaction to them being too restrictive. I think it is more that they are trying to incentivize those that are unvaccinated in the United States to get the vaccine. I think it's more of that carrot in the hopes that, people will feel like if they get vaccinated, then they'll be able to get something. And certainly taking their masks off is a big incentive. I think that's more of it. I mean, we do know, we're getting more data, with each passing day about the decreasing in transmission. The reason that when you're vaccinated, you're less likely to pass on the virus is twofold. One is that you're less likely to get infected in the first place. But the second is even if you're infected, we know the amount of virus tends to be lower. And we already know through household studies that you're less likely to transmit within the household. So it's all good news.
Roughly half the country currently has mask mandates in place. So what does this guidance mean in those states?
Diane, I do think it means that we're going to be able to go in that right direction, and it's reasonable to do away with these mask mandates. I mean, there still are going to be places indoors when we should be wearing a mask, even if you're vaccinated. But for most places where we are, vaccinated people will be able to take off their mask. And remember, the cases are falling. For the first time, we're seeing daily cases below 40,000 a day. And also deaths are at an all-time low at 600. We still have a ways to go. You've heard me say before, I really want us to get below 10,000 cases a day and dropping. Then I'll be taking a sigh of relief. But we're doing really well right now. There's no question about that.
So how do businesses handle this when there's no way to tell just by looking at someone whether or not they've been vaccinated? So do you just assume everyone on the honor code and let everybody in without a mask?
Isn't that going to be food for thought going forward? A lot of people are thinking about how they're going to conduct their businesses. Are they going to look for that vaccine passport, or are they going to use the honor code? And I have a feeling in the beginning there's going to be a bit of heterogeneity there. But I think the important thing we do know is that more than 50% of adults have received at least one shot, and more than a third of the country is fully vaccinated. We're on the right track.
But, Doctor, isn't it still an open question whether a vaccinated person can be a carrier of the virus? What's the science on that? And if an adult spends time indoors without a mask and is exposed, could they perhaps bring that home, transmit it to, say, unvaccinated children?
Yeah, so again, what most of the studies have shown is that once you're vaccinated, you are markedly less likely to get infected in the first place, right? We've seen some of those studies, 90% or higher less likely to get infected. And what I mean by that is just carrying the virus, forgetting about symptoms. If you're not carrying the virus in the back of the nose, you're not transmitting it. Also, again, very importantly, the vaccine makes it so if you're infected, which can happen, we know that happens, you're less likely to have large amounts of virus. virus, and viral load is important. The greater the burden of virus, the more likely you are to transmit. So getting vaccinated is important on all grounds, and it's going to decrease transmission. Now remember, you absolutely can get infected after you are fully vaccinated, and rarely you can have severe illness. But when you look at the difference between unvaccinated people getting hospitalized and dying compared to vaccinated, it's a world of difference. The vaccine is that powerful.
All right. We like that we're moving in the right direction, Dr. Ellerin. Thank you.
It's a good day. It's
sure
a good
is.
day, Diane. Bye, Terry.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.